I'd like to talk to you today about neurofunctional pain management. Neurofunctional pain management is a new type of pain treatment program. I say new, though the technology behind this has been around for decades. The process and the protocol of neurofunctional pain management has been entering the market over the last several years as an excellent alternative to some of the conventional therapies and treatments for chronic pain. Electroanalgesic therapy is the first component of the neurofunctional pain management process. Electroanalgesic therapy is a high pulse electrical current that produces a pain relief effect. This technology has been in the market in the medical field for nearly 40 years as an FDA cleared treatment for chronic pain. The reason you probably haven't seen it is that the treatment process for electroanalgesic therapy is a little bit time consuming. A lot of doctors just don't have time to engage in a therapy like this, even if it does work really well. And they stick to things that they can do more quickly in their office. Another reason why is that a lot of offices are just not set up for the space needed for this. And I'll explain that here in a second, why the space is such a big issue in some of these offices. So electroanalgesic therapy produces this pain relief effect. And we combine that therapy with two other components. We combine it with IV nutritional therapy. So we have a vitamin and mineral IV mix and health coaching. And we'll explain more about why those two additional items are very important. Going back to the electroanalgesic therapy, a lot of people are familiar with a TENS unit. A TENS unit is a very different device. The FDA classifies electrical devices by their pulse per second range. So how many times the actual current will pulse in a second. And the important factor in that is that different tissues will actually respond very differently to different pulses per second. A TENS unit will achieve about 450 pulses per second at the most. If you brought an electrical device into the medical field, the FDA would look at how high it can go, and if it can go between 1 and 450, they will call that a TENS unit, and they'll put that over in the TENS unit category. If you are bringing in a device that can achieve thousands of pulses per second and go up to, say, 10,000 pulses per second, they would classify that as an electroanalgesic device. And it affects the tissue very differently. A TENS unit can stimulate muscle tissues, and it's very good at that. And the electroanalgesic device can stimulate other tissues, neural tissues and vascular tissues and other tissues of that nature. And it does that very effectively. And they would call that device an electroanalgesic device. And then they would consider that device a little more sophisticated, and they would also require that device to go through trials. So the device we use in neurofunctional pain management has been through all the appropriate FDA trials, making it a clear device for the treatment of chronic pain. One of the benefits of using an appropriate device for this is that that's what allows it to be covered by Medicare and commercial insurances. You may go to other offices who have other devices, but they are most likely not the same thing. I'll explain those factors here in a few minutes. So going back to electroanalgesic therapy. So what is it actually doing that's causing this pain relief? Well, the first thing it does is it actually produces a neuron depolarization or pain neuron depolarization. What that means is that it's stimulating the neuron so fast that it doesn't have time to repolarize. This means that it can't report pain. So that's the first step in achieving a pain relief, is that you're effectively blocking the pain signal. And that actually will turn off the pain and inflammation cycle. If you're not familiar with that, if you have an injury, say you have an injury, and you get swelling, right? It will become swelling and bruised, and all these things happen to it, right? That's your natural response. If you have a chronic pain issue, you've got a continual signal of pain going to the brain, and that signal is stimulating all sorts of activities. Inflammation is one of them. But you've got that happening on a continual basis, right? So you got this pain inflammation cycle that keeps on processing. The more inflammation you have, the greater the constriction in a given area, and that causes even more pain. And then that signal goes to the brain as well, saying we have a problem down here. Send help, and that help happens to be inflammation. But it's not healing that tissue and it's not getting better, and it's a chronic pain issue. And so that's why it's so difficult to treat. The other thing that's happening during electroanalgesic therapy is that your neurons are releasing neuropeptides and neurotransmitters, right? They're being depolarized, so they're opening up and they are letting out all of these neurotransmitters. Here's three that are very effective at helping this pain process: endorphins, enkephalins, and GABA. And there's a reason why all three of these combined actually produce a pain relief effect. Doctors I've worked with for years have said that that triple combination of neurotransmitters is effectively a runner's high, or the feel good effect you get after working out. You get a good workout in, you feel great. The rest of the day, that's the effect that the electrical therapy will produce. And a lot of people that aren't even in chronic pain actually like are receiving these kinds of treatments. There's a lot of other physiologic benefits that occur even if you're not in pain. If pain is not your objective, there's still other values to this. That those neurotransmitters produce a lot of additional benefits in the body, a lot of cardiovascular benefits. People have regulated and better blood pressures. That is not something that everyone gets, but some people have that occur. Those neurotransmitters do quite a bit. So you have a lot of people that like that, using electrical therapy to try and help their overall physiology, right? But for our purposes, it works great to get a patient out of chronic pain. The next concept here in the neurofunctional pain management program is an IV hydration therapy. This would be basically a vitamin mineral mix that is administered once a week during the program. Oh, I should mention too that the neurofunctional pain management program is an 8-week program that consists of 2 1-hour treatment events per week, and this is performed in your own home. I'll go into why you need that 8-week program here in just a second. The IV therapy that we just mentioned, it's an important factor in the overall therapy process. You need good hydration. Everyone knows hydration is a critical component to good health. But it's not just the hydration, it's the vitamins and minerals in there as well. And that's very, very useful. One of the benefits here is that when you are relieving all the inflammation from the electrical therapy, the better the hydration that your body has, the easier that process is. So we have noticed over the years that people who do the IVs will tend to get out of pain faster and stay out of pain longer. And so that becomes one of our priorities, is to make sure people are doing the consistent IVs once a week. And then health coaching is also the third component of neurofunctional pain management. Health coaching is important for many reasons, but one of them is that you just need someone to be with you while you're going through this process and helping you set goals, helping you stay on track. All those things are so important. And the nurse who's out there performing your treatment happens to also be your health coach along the way. So over the course of 8 weeks, you're going to have someone who's helping you get out of pain and helping you get back into a better state of health. So that's exciting. So the 8-week program. A lot of people ask, why 8 weeks? Well, there's a lot of reasons for that. The primary reason is that for the electrical therapy to produce a long-term effect, the treatment needs to occur multiple times. So let's go back to that pain depolarization, the neuron depolarization. If I were to perform that treatment once, the neuron would stay depolarized maybe a couple of days, right? So you'd have this pain relief, pain reduction effect that might last for a couple of days. But that's it. And then the pain would come back. If you continue to do that treatment over and over, the neurons and your entire region where the pain is occurring, the neurons don't report pain. It takes longer and longer for them to repolarize and get to a state where they can actually report pain again. And that entire time, all the tissues are actually recovering. The inflammation is leaving that area. All the benefits are occurring, and you keep that going for 8 weeks. The result is that the effect that is achieved can last for months after you complete the program. So what are the success rates of this treatment program? Neurofunctional pain management has a track record of success that is about 85%. Now, this is a figure that we've asked doctors in a lot of the offices we've worked in for years. What would you say, based off of talking to all your patients and all the the data that you've collected and everything like that, what do you say is the average success rate? And they will tell us that it's easily 85% of everyone coming in the door and all the different pain conditions coming in, 85% success rate of getting people to a greater than 50% reduction in pain. And pain doctors often qualify their success in the form of a 50% reduction. That's their target. They're aiming for that much of a relief. So if you're saying that your pain is at 8, then they're aiming to get a 4 or less by the time they're done with the program. But for some of you out there, you've had chronic pain for decades. And so having that pain cut in half would be an amazing result for a lot of you. And I've seen people that even just a little bit of relief goes a long way, right? A lot of people can actually get all the way out of pain. We have our anecdotal stats for people getting all the way out of pain. It's about somewhere between 30 and 40%. So some people are going to be very successful in the program. Different people have different physiologies. Everyone knows that. Some people respond very well to the program. Their body seems to respond to the electrical currents. Their body is responding to the IVs, and they get out of pain very quickly. We've had people that would get out of pain in the first treatment, and then suddenly, oh wow, I feel great. I'm already out of pain, and they've had pain for years. But they need to keep that process going. You need to stick to that 8-week program if you want it to endure. So 85% success at getting people out of pain. And then how long does it last is another question people ask. Well, our track record for patients and our objective is somewhere 3 to 6 months. We're aiming for a 3 to 6 month relief effect when someone completes the program. So that's amazing. If you can do something like this, it's very simple, it's very safe, and you can get 3 to 6 months of pain relief without any additional anything, no more pills, no nothing for 3 to 6 months. That would be an amazing accomplishment. A lot of patients would love that. I know they would. So let's go into for a second, what kinds of actual pain conditions we can treat. So a lot of people will ask that question. Do you treat this? Do you treat that? So in neurofunctional pain management, we can treat basically any type of musculoskeletal related chronic pain. So I'll just list a few that are the most common. Peripheral neuropathy, upper or lower extremities. And it doesn't matter what the cause of it is, if it's diabetic peripheral neuropathy, or if it's some other issue, medication related, something like that. So peripheral neuropathy, joint pain, right? So knee pain, osteoarthritis pain, right, in the knees. That's probably the second most common thing people are looking for is my knees are in pain and I'd like that treated. And the third most common issue is low back pain or sciatica. So a lot of people have that issue. Additionally, those are the 3 most common pain conditions that people are coming to us for treatment for. We can also treat a range of other conditions, probably about 24 different pain conditions. I'll just list a couple here, fibromyalgia, trigeminal neuralgia, TMJ, and there's just a range of other pain conditions that some of them are pretty rare, some of them are fairly common, and we can treat those very effectively. And the average of 85% across the board on all of those pain conditions. So why don't you see this program in offices? Like I mentioned earlier, shouldn't this be more prevalent? Well, we're trying to make it more prevalent. Some doctors are very familiar with this type of technology and our program, and they love it, and they actually promote it and use it, and that's great. Like I mentioned before, if you're going into the office, into a doctor's office twice a week for an hour, that becomes very difficult for an office to handle. They could probably only accommodate a dozen or two patients, a couple dozen patients, and that's it. And then suddenly they don't have any more room. And so it's just a very different, very different type of treatment model. Some doctors, like for instance, a primary care office, they don't have a lot of time at all, and they have a lot of people coming through the office with a lot of different issues, and they have to just cycle through everyone as best they can. And everyone knows that. And then, of course, you got specialty doctors, and they specialize in different things. Let's, say for a second, a pain specialist that's doing interventional procedures, the spinal injections and all those things like that. Well, there's a reason for that too. One is that they can actually get those done in a fairly short period of time, whereas our program takes a lot more time. Their office probably is relatively small and geared for doing those procedures. They're not really set up to do this, right? To do neurofunctional pain management. So it becomes one of those things where, they know it's there, but then they don't really have a way to incorporate it very conveniently. That's why I decided that this would be best in a mobile setting. If we had people that were being treated at home instead of in the doctor's office, that would actually be the best way for this to work. So that's where I decided to create the relative mobile pain treatment program. So in that regard, if you are able to move forward with us and actually achieve a treatment with us, a treatment program with us, we would be able to send the nurse out to your home to conduct those treatments in your home. And we would love to do that. We would love to work with you. So when you're finished watching this video, reach out to us. All we need to get you started is to have a chat with you. We do a patient navigator call where we actually talk to you. We actually check your insurance for you to see if it will be covered by your payer. Most people are able to get this covered. This program is covered by Medicare and commercial payers, and most of the specialty insurances, the ones that I would say smaller group plans, things like that, they all cover this. It's just a matter of calling them and getting the info for it. And so we'll be able to work with you, and we're looking forward to working with you. I hope you reach out to us, and we'd love to help you get out of pain and change your life. Remember, our slogan, our motto, and our mission statement is to relieve pain, restore health, and magnify quality of life. And we all believe in that mission. So we look forward to working with you. Thanks so much.